Today's topic is GERD, that is Gastroesophageal Reflux Disease. The term gastroesophageal refers to the stomach and esophagus. Reflux means to flow backward or return. Gastroesophageal reflux is when the content of the stomach back up into the esophagus. It is a disease occur when the stomach acid leak from the stomach moves up into the esophagus. This is also known as reflux, that the stomach acid or the bile irritate the food pipelining. Next is the lower esophageal sphincter. When we eat, food passes from throat to the stomach through esophagus. Esophagus is the pipe that connects the stomach and our mouth. A ring of muscle fiber into the lower esophagus prevent the swallowed food from moving back up. These muscle fibers are called as lower esophageal sphincter. When this ring of muscle doesn't close all the way, the stomach content can leak back into the esophagus. This is called reflux or gastroesophageal reflux. It is due to the smoking, eating large meal, eating at late night, eating certain foods like fried food, fatty food, spicy food, citrus fruits, citrus food, drinking certain beverages, alcohol, coffee, late night, taking certain medications such as aspirin. It is due to these type of causes. Prevalence 10 to 20% of the people having this type of disease. Most common GI gastrointestinal disorder is this. Increased, you can see these type of diseases in obese persons and due to their lifestyle also. Risk factors of gastroesophageal reflux is, first is obesity. It increases the intra-abdominal pressure on esophagus. Pregnancy, progesterone relaxes sphincter muscles, and fetal pressure is also in esophagus. Then it can it can pressure on the acid or acid reflux is there. Smoking decreases the lower esophageal sphincter pressure and increases the acid secretion. Alcohol and coffee relaxes the sphincter muscles and increases the acid secretion. Muscles are relaxed and then acid is there, then it can move upward to the mouth or esophagus. Fatty spicy food also trigger the reflux. Antacids or medications also lead to reflux. Reclining within 3 hours after eating, it also causes to the reflux in the stomach. Next is pathophysiology. Pathophysiology of this is very simple. If the lower esophageal sphincter doesn't close properly, these muscles doesn't close properly, then there is a decreased lower esophageal pressure inside these sphincters, and intragastral pressure, gastric pressure increases. Hypersecretion of acid is there. If pressure increases, then high secretion of acid or reflux is there. Prolonged esophageal mucosal acid contact with esophagus increased. Esophagitis, esophagus, inflammation of the esophagus occurs and decrease the acid clearance from the esophagus from impaired peristalsis. Peristalsis means food moved upward in the esophagus. Then the GERD occurs in the body. Means basically it's very simple. If the lower sphincter muscles doesn't close properly, then the food move upward in the mouth or in the esophagus. This is the pathophysiology of this GERD. Next is the clinical manifestation. Clinical manifestation is basically heartburn, acid indigestion is there, then heartburn or burning sensation you can feel. Burning in the chest pain is also there behind the breastbone and move upward. It is not cardiac pain, it is the pain due to the reflux. Feeling like food is coming back into the mouth. There is a feeling that food is coming back or acid is coming back. Pain in the stomach, nausea, bad breath, trouble breathing, hard time to swallow anything, vomiting, dental erosion is there, wearing away the tooth enamel, and laryngitis, sleep problems are also there. Next is the diagnosis. You can clinically check the problem within 24 hours. pH monitoring is there. If it's hard to make the definite diagnosis, your doctor may measure the acid level inside the esophagus through this test. pH testing is there. Next is endoscopy. A small lightened tube is put with a tiny video camera on the end called endoscope into the esophagus to look for inflammation and irritation of the tissue. If the results are abnormal, then a small tissue sample can be removed for more testing. This testing, removing of tissue, is known as biopsy. If you enter the endoscope or put the endoscope in any pipe, then it is called as endoscopy. Esophageal manometry is there. This test check for low pressure in the esophagus. It can also show the defects in how your esophageal muscle contract. What is the tone of the esophageal muscle? Next is barium swallowed. Barium, you can also swallow the barium to check the hiatal hernia, a condition in which a part of the stomach move above the diaphragm. Then it is known as hiatal hernia. You can check from the barium introduction into the body. Next is non-pharmacological treatment. First is dietary modification. Avoid the fatty food, caffeine, alcohol, citrus fruit, spicy food. You can avoid these type of food to get treatment, to get cure of this GERD. Eat small meals. Avoid eating 2-3 hours before the bedtime. Before bedtime you cannot eat much more. Then second is the weight reduction. Obesity is the major cause, as you all know. Many overweight people find relief when they lose weight from this GERD disease. Lifestyle changes. Elevate your head off the bed 6 to 8 inches. Avoid laying down immediately after the meal, in afternoon or at night especially. Wear loose clothes, clothes that squeeze your waist, put pressure on your belly and the lower part of your esophagus, and causes the reflux. Smoking and alcohol cessation. Smoking, if you can stop smoking, stop alcohol intake, then it will increase the tone of the sphincter muscles, sphincters. Or otherwise, if you smoke regularly and take alcohol regularly, then it will decrease the tone of sphincter muscle. Pharmacological treatment is there. First is proton pump inhibitors. These drugs block a protein needed to make stomach acid. Examples are omeprazole, pantoprazole, esomeprazole are the examples. H2 blockers are there, H2 receptor antagonists. These medicines bind to H2 receptor on the stomach and block the acid secretion in the stomach. Cimetidine, ranitidine are the examples. Third is antacid. These type of drugs neutralize the acid in esophagus, stomach, and stop the heartburn. Example is, as you all know, commonly used aluminium hydroxide gel, calcium carbonate, magnesium hydroxide, milk of magnesia is used as an antacid. Last is the prokinetics. In rare cases, these drugs help your stomach empty faster. so you don't have as much acid left behind. They may also help with the symptoms like bloating, nausea, vomiting. Examples are domperidone. Very commonly used drug is domperidone to control the nausea, vomiting, and bloating. Also relief from the reflux. Thank you.